Hi everyone, welcome to your CPE200. In this clinical, you will integrate theory from Term 1 and Term 2, which now includes medication administration on top of the overall nursing care. At the end of this clinical, students will learn to practice within relevant legislation, the entry level for licensed practical nurses, understand the definition of consent, develop critical thinking, apply the nursing process and consistent client-specific decision-making skills with collaborative approach, effective communication, identifying own values, and participate in continuous learning to maintain competence. Your clinical instructor will be with you for any support, or you can also email the clinical practice team if your instructor is not available. As a student, you must introduce yourself to staff members, wear your IDs at all times, follow your clinical instructor's guidelines and instructions, listen to feedback, complete all assignments, take initiative in clinical, and follow the BCC&M standards of practice. Students must always use mechanical lifts with the presence of an instructor or other qualified staff member until student is safe and competent. Always follow the host site policies and your instructor. Evaluations will be provided by the instructor, and the student must work on meeting the competencies for clinical. The instructor can provide a student with prompt verbal or written feedback via email, and together should discuss the issues and create a plan for remedial action. The clinical practice manager will be consulted. A student success plan will set out clear expectation for performance and is signed by the student and will be placed in the student's file. A referral for other support resources will also be available and will be documented. If the student is unable to meet the required agreements upon the student success plan, the student will be at risk for failing clinical and can be removed from the site. The student must be provided with a written documentation and will be given an opportunity to respond verbally and in writing to the instructor's feedback. Students must complete all scheduled shifts and has only one allowable absence during clinical. A letter of expectation will be given, and student could be at risk for failing clinical if attendance is not met. For a total of 2 lateness or leaving early, this will count to 1 absence. No proper call-in procedure for 1 absence is considered 2 absence. For injury or emotional trauma, a doctor's note must be provided stating that a student is fit to resume all responsibilities to continue with clinical. Here are the assignments for CPE200. Starting with the site orientation your first day, which needs to be signed by yourself and your instructor, and to upload on Moodle in the appropriate Dropbox. Next is the weekly reflective journal, which is a total of 1 to 2 pages and double-spaced using the ORID model. Keep your client's confidentiality by only including the initials. Follow your instructor's instructions when it comes to due dates and when to upload on Moodle. Next is a learning activity where you will be able to define and describe your client's diagnosis, signs and symptoms, labs, and medications. Answer the following questions and provide a written research on this report and present it to your instructor. For concept mapping and nursing care plan, you will research on your client's conditions, medications, and other treatment regimens and will formulate care plans to assess, identify goals and potential problems, plan, implement, and evaluate interventions that will assist in meeting the client's holistic needs. You must submit 2 concept maps and 2 nursing plans. For the leadership assignment, you will be presenting this in front of your peers. You will select a health issue that you have identified in your concept mapping and nursing care plan assignment and deliver a teaching plan during post-conference. This presentation should be no longer than 20 minutes. Your instructor will schedule you to present in week 3 and in week 4. By this clinical, you are already familiar with the self-assessment. You will add 3 comments for every competency, rate yourself, and fill out the reflection at the bottom. Your instructor will also provide you with feedback on these competencies. These are the entry-level competencies for licensed practical nurses. If evaluated by the instructor that the student needs further support, a learning plan can be assigned for the student to complete and to submit on Moodle. For medication errors, a medication safety learning document must be completed. For any additional support, you may contact your clinical practice manager. On behalf of the clinical team, we wish you all the best of luck for CPE 200.